Hello there, and welcome to another Wellness Wednesday. This week we are talking about holistic options for earaches and bedwetting, but I'm going to take it a step further. You know that this month we're focusing on family care. Our office is a family chiropractic and holistic health office, so that means we are able to provide not only chiropractic but holistic health care for all the ages and stages of your life. So we do take care of babies and children in our office. We take care of adolescents, teenagers, young adults. We take care of pregnant women, we take care of women going through menopause, we take care of men and women that are going through their ending stages of life and getting more active after retiring, as well as patients that may have osteoporosis or have had previous surgeries due to degeneration or other health issues. One of the things that I like to really talk about is how, as we go through our life, a lot of times we're starting out as a baby and sometimes things don't always work well as we're going through the growth. We see a lot of health issues, specifically in our office, with earaches, issues with latching or colic in our office, issues with digestion in kiddos. But we're going to focus a little bit more about earaches for kids and talking more about why kids are more prone to having ear infections. And, sometimes doing the tubes in the ears may not be a great option. A lot of times, with some of those tube surgeries where they put the tubes in the ears to help children's ears drain so they're not getting fluid and getting chronic ear infections, we actually, by putting those tubes in some cases, they don't always like to stay within the eardrum itself. And what'll happen is those tubes will come out. We've got a hole in the eardrum, which can cause a whole other health issues and host of health issues as we get older. But what's interesting too is when we look at earaches and kind of the anatomy as a child and how that changes to basically when we're young, our ear canal is in a completely different position. So we're going to have more prone to having fluid stay within the ear and stay behind that eardrum that can lead to ear infections. But also, as we're getting older, as we're dealing with stress throughout our lifetime, sometimes from clenching your jaw, you can actually change the position of the jaw and actually cause arthritis within the actual jaw itself. So popping, clicking, snapping, arthritis within the jaw, TMD, TMJ issues. A lot of times, because that is so closely related to the ear, that jaw and degeneration and not things not moving properly in the jaw can actually contribute to and cause ear pain and cause even issues with hearing and how your body is actually getting nerve signals from the ear that can cause issues. So we're going to talk not only kids, but we'll talk a little bit more about adults at that age, at that point too. We're going to talk about bedwetting, and I'm going to also add incontinence in with this too. Typically when kiddos are young, as their bodies are growing rapidly, sometimes we may have nerve pressure from injuries that happen. I mean, kiddos when they learn how to walk and crawl, they're falling down, they may play sports, they may roughhouse with their friends. All those things can cause damage to some of the nerves in the lower back, and those nerves actually go to our kidneys, actually go to our ureters, actually go to our urethra, and actually go to our pelvic floor, helping us know, number one, when to void, how to void, but also how to cut that off so we're not having issues. As we get older, if we've had issues with muscle development or muscle loss or degeneration, sometimes those nerve signals are lost due to arthritis or due to trauma as we're older, and we may have issues, or even sometimes after delivery of baby, the pelvis may have actually shifted, changing how that pelvic floor works or changing the nerve signals going to the organ systems and the pelvic floor. So we can have issues not only with incontinence, we can have issues with prolapse, we can have issues with even just number one, having issues with everything from going to the restroom to sexual intercourse to all these other things can all be complicated. And like I said, ages and stages, whether you're young and just starting to develop and kind of getting things balanced, or you've maybe had some damage and seen some things throughout your life, we can kind of help you throughout that. So I have today, I want to talk a little bit more about anatomy. So I have a book I'm going to show you some pictures in, because I think if you can see it with your own eyes and understand how it works, it helps you kind of recognize what's going on and how you can support that system a little easier. So what I want to start with is birth. So from the birth process, we actually have a multitude of bones that make up our skull, and we have thick pieces of cartilage in between those as we're going through the birth canal. And what happens is typically as baby is born, those bones overlap to get through, and then they open back up again. And then as we age and the bones get bigger and bigger and bigger as our brain grows, we start to get, whereas the bones grow together, we still have some very slight amounts of cartilage there that can allow for some motion of the bones. They don't fuse completely. So a lot of times in my office, I can do cranial work not only for children and babies to help the bones move and kind of go together a little bit better, but for adults that are having issues with headaches or jaw pain or tension, a lot of times we may also do some cranial work to help with jaw pain, to help with sinus drainage and headaches and things like that too. So I'm going to show you a picture of the baby skull, and then just know that as you get to an adult and the bones grow, they kind of come together and we have not cartilage in between, but more of like a sliding joint that has a little bit of motion left. So here's a picture. I'm going to kind of zoom in so you can see this book is very heavy, so bear with me. So as you see here, this is a baby skull. There is tons of little bones that make up not only the skull, but also the face. And then as we look from the top, we have those soft spots. You actually have two soft spots on the baby. Everybody knows about the one on the top of the head, but there's also one near the back of the head here too. So everybody knows about this one, but that other one back here is also really interesting. And then if we look at that first one, there's even another one here behind the ear. So literally there are 3 soft spots in babies. And if those bones aren't moving properly, that can cause tension not only on the muscles, but also causing how the muscles are working differently. That can actually cause pressure on the neck and the shoulder. So if baby's having a hard time with certain positions, like say they don't want to be held in a certain way, or they do not like to feed on that side, or don't like to be held that way, or don't like to sleep that way, a lot of times that may be because they're uncomfortable. They could have tension on some of the structures in the nerves in the neck that make it uncomfortable to be held in that position. Their muscles might be tighter on one side, specifically either from birth or injuries, or sometimes even as babies are sleeping funny. I don't know if you've ever seen a baby sleep, but they sleep in some really weird ways. So sometimes we can have bones shift from trauma, from even how they're eating or feeding or being held, sometimes even how they're sleeping. But a lot of times I'll see birth injuries or injuries as they are kind of learning how to scoot or learning how to crawl or learning how to walk. We may have some injuries, or sometimes if they've got siblings aren't always the nicest to each other, so we can have injuries from that too. But what's really interesting to me, so I showed you the bones, but what's really interesting is when we look at how that jaw actually goes up here, because I mentioned the jaw is very close to the ear. So for those of you that are having jaw issues, popping, clicking, snapping, it may lock up on occasion, or we're hearing grinding sounds in that joint, or it's maybe painful to chew, or if you're having ear issues along with that, a lot of times the jaw itself, it actually starts up here, kind of right up against your skull. And then as you are opening your mouth, it drops down, and then there's a disc that it glides forward on. So there's literally a kind of a weird motion where it goes down and slides forward across the bones to allow that to move. So if we have issues with the jaw not moving properly, that can also cause pressure on the ear because we're affecting nerve damage. So here's the jaw. As you can see, that little blue disc right there, that blue disc is actually, as you put your mouth closed, that cushions the joint so that we're not getting grinding of the joint. And then as you open, that bone shifts down and glides across there. There's really not a disc like this in the body. That's the only one that's like that. That blue cartilage is actually suspended by a ligament in the front and a ligament in the back that crosses. So literally the only thing holding that joint together is ligaments. So what happens is as the bones go down and glide forward, the only thing controlling that motion is your muscle. So if you have muscle imbalance in the jaw or the neck, sometimes what will happen is the muscles are stronger on one side, so it's going to pull your jaw to the side. So if you open your mouth and it pops, if you open your mouth and it veers off to the side, those are signals from your body that that jaw isn't moving properly. In babies, a lot of times from the birth process, or sometimes how they're sleeping or pressing up against things, their jaw can shift out of place, and that can cause issues where they're not latching or nursing properly. They may not be applying the proper suction to their bottle, or if they're being nursed, if they're nursing with how their latch is going. And what can happen is as they're swallowing, the jaw is not moving properly. So they may be using more muscle since their jaw isn't moving properly, which is going to tire them out faster. And a lot of times they can't get the nutrition that they need. So if you have a baby that's having issues with sleep, issues with nursing, issues, like I said, with colic or not really liking certain positions, those may all be signals from your baby telling you, hey, something might be off in the skull, in the jaw, in the neck or the shoulders. There might be muscle tension going on that could be causing issues for how they are functioning. And like I said, nursing is really important, especially because babies have to get a lot of nutrition from their food so they can grow very rapidly and develop properly. So if they're not eating properly, if they're not getting the right things, that may be due to an issue in the jaw. And then specifically how that affects eardrums. So in babies, your ear canal is actually more horizontal. So when we have fluid that gets in the ear, or if we have fluid behind the eardrum, a lot of times that fluid, as your body tries to get rid of it through the lymphatic drainage, will basically go down the neck and into the chest. But if we've got tension in the neck, if we've got tension in the chest, it can't drain properly, and the fluid sits there within the ear, and then it can start to, if we have inflammation, start to form, irritation, and that's a very big environment for bacteria to grow. So that can a lot of times form earaches and ear infections too. So with kiddos, typically, their ear canal is more horizontal, so things don't always drain as we'd like it to. But I have a picture of the ear canal, so I'll give you a little anatomy on this one too. And this can also affect hearing too, and I'll show you why. So when we look at the ear canal, so this is the outside of your ear. You've got the ear canal going in. This is an adult, so it is a little bit more angled here. And then as we look at the tympanic membrane, so this is a protective mechanism within your ear so that you're not pushing through into the actual ear itself. We have these bones here that actually vibrate, and they're going to, we have these yellow nerves here that pick up signals. So when you hear things, your body is going to have bone conduction, which is when these bones are moving with sound. And we're also going to have air conductions where these hairs within the actual ear canal vibrate, and your nerves pick that up and say, okay, this is what I'm hearing. But what tends to happen is with babies, because their ear canal is not angled down like this, that fluid sits within the ear, and we're more likely to have inflammation and infection. So a lot of times putting a tube within the ear doesn't really help much with that drainage. The best thing for drainage a lot of times is making sure that the neck and the jaw are all moving properly, and that they're actually swallowing properly, because when you swallow, that actually changes pressure and will pull fluid out of the ear. So if we've got an issue in the neck or an issue with tension here where it's not draining properly, that can predispose them to having backup and eventually leading to ear infections or earaches. Like I said, it can also affect latch and a lot of other things too. So that's your first stage. I talked a little bit more about how your bones come together, how your jaw works and moves. I talked a little bit more about the ear and how that system works. So if you're having issues, whether you're a baby or an adult, it doesn't matter. That anatomy is still there. It just changes a little bit as you grow. And then we're going to talk about bedwetting and incontinence, because like I mentioned, bedwetting is not just about, kiddos, but it also affects adults too. So when we look at your spine, which I have a sheet here that I think you will find very interesting. Let me pull this up here. This is the big book, bear with me. So we have, this is basically your spinal nerve function chart. So this shows autonomic function. So each and every single bone in your body has nerves that exit from these little holes here. So we have those bones stacked on top with that white disc in between that helps supply shock absorption, and a hole which is where your nerves come through. So your brain and spinal cord send all the messages for everything to work through this tiny little hole here. So if these joints aren't moving properly, if they have arthritis in them, if we have muscles that are twisting those and making those holes a different shape, those nerves get compressed, and it can affect a lot of different things. So I have this here in the office, but if you would like to get a copy, you can definitely stop in my office. I have these, or you can look online for autonomic nerve function. Basically what happens is, as we look at the spine, these bones go to specific organ systems, and then we can have symptoms if they're not working properly. Typically, when I have patients that are coming in that are having organ issues, so anything from kidney dysfunction to urinary dysfunction to bladder dysfunctions to chronic bladder infections, a lot of times the nerve function in that lower back, or that like kind of mid to low back area, right, kind of brow line area, those nerves go to the kidney. A little further down, those nerves go to the ureter. A little further down, those nerves go to the bladder. A little further down, those nerves go to the pelvic floor, so that we can push out urine and push out any type of bowel, and bowel movements and things like that. So if those nerves aren't working properly, we're not getting proper nerve signals to tell those organ systems how to work properly, and that can cause issues where we may not be feeling the signal because the nerves aren't sending it properly to know we have to go to the bathroom. We may maybe not have the best control. So at night, your body's not regulated to keep that tight, or not waking you up to know, hey, it's time to go potty, and we can have accidents from that. I've also seen kiddos that had frequency and urgency of avoiding. So literally, they're sitting down and they feel like they have to go every 5 minutes, and they may have maybe a dribble or two or nothing coming out, but that urgency is there over and over and over again because those nerves are not working properly. Instead of sending a signal only when there's a fill response in the bladder to let us know, hey, gotta go potty, they're not really getting that signal properly. So either they are getting a constant signal where they have to feel like they have to go all the time, or they don't really get the signal until they're either going or, oh, I have to go right this second and that's all I got. But as we get older, if we have arthritis in those same bones, or if we have damage in those same joints, or if we've had surgeries or things like that, we can actually have where the joints themselves break down and press on the nerves, or the muscles are tight on one side and twist and press on the nerve. And that can affect the nerve function to the kidneys, the ureters, the bladder, the pelvic floor. And what can happen is we can see where perhaps we are going to the bathroom and losing or getting incontinence when we are sneezing or coughing or just simply existing. So if you have incontinence issues, if you have bowel function issues, somewhere along that pathway, you may have issues in the spine that could be contributing to those. So in our office, typically, I like to, number one, find out, well, where is our issue coming from? Is it coming from feeling? Is it coming from nerve function? Is it coming from the pelvis maybe twisted, where the pelvic floor is twisted and not working properly? Is it coming from the pelvic floor muscles not working properly, or the nerve signal not getting there properly? So we've got to figure out, is it a bone issue? Is it a nerve issue? Is it a muscle issue? Is it an arthritis issue? Is it something else? Maybe we've lost muscle mass due to digestive issues or other health problems that could be contributing to that. So a lot of times what I'll do is I'll actually look at specifically the bones in your pelvis and the bones in your lower back to see how that's all working. So I showed you the spine already, but I'm going to show you the pelvis because it's a little bit different. So we'll look at anatomy here first. You have, basically, if you look at a picture of the pelvis, so you have your pelvis, we have the iliums here, and then the sacrum, which is kind of like an arrow shape, that's the very bottom of your spine. So that bone there takes all the pressure of your body, spreads it out into the ilium, and then your iliums put pressure down your legs into the floor. So if we have an issue in the spine or arthritis in the spine, that can cause problems. We can also see issues in these joints here, or if the pelvis is rotated or not moving properly, that can cause a problem too. I know in our last video earlier this month, I think that one was how chiropractic helped my pregnancy. I talked a little bit more about the pelvic floor and that opening for when baby is born, but it's also going to have the same impact when we're looking at pelvic floor disorders. So if we look at a picture here, your pelvis, if we're looking from a top view, so here is the spine right here. So here's the sacrum, and then this is the very bottom of kind of your butt cheek area. And then there's the front up front there. You have this ring shape that's created, and all the muscles that are suspended within those make up your pelvic floor. So if there's anything that is twisted or not moving properly, that hole can become more of an oval shape, or it can become tight on one side where the muscles aren't working properly. And that can affect a lot of different things. So we can see, like I said, nerve function and bedwetting issues in kiddos, but we can also see that affect also other anatomy for adults too. So I have a picture here of basically the male pelvic, we'll start with the female pelvic floor. So this one here, you can see, let me pull down here a little bit. So we have back here, this is the spine, and then we have the ligaments going across the back of the spine, and then we have our rectum, we have the vagina and the ureter all stacked on top of one another. So if these muscles are tight on this side, it may not be keeping that sphincter where it's supposed to be and helping it to stay tight. So if the muscles are tight, that may not open properly, and that can cause issues with, like I said, voiding or losing control of bowel function. In the male, it's a little bit different, but pretty much same concept here. So in the male, we have, again, that pelvic floor. We have the sacrum back here, those ligaments going down the sacrum, and then we have ureter openings as well as openings for rectum. So again, if we have issues with how the pelvis is moving, or if it's twisted, that can affect pelvic floor dysfunction, that can cause incontinence, that can cause bowel dysfunction. It can even cause pain during intercourse. It can cause, just pain in general. I've had some women that after labor, they were having pelvic pain kind of on and off, depending on what they were doing. There were certain positions or certain activities or certain motions they couldn't do due to back pain or pelvic pain or even hip pain, because those nerves in your lower back go all the way down to your feet. So if the pelvis is rotated, it's going to affect not only your lower back and how your muscles move in the pelvic floor, but we can see hips, we can see knees, we can see ankle pain coming from the fact that that pelvis is rotated, and it changes the whole entire anatomy and biomechanics of the lower leg. So if you have joint issues in the lower leg, if you've had twisted ankles, if you have plantar fasciitis, if you have knee pain, hip pain, or even degeneration or arthritis in those, that may actually be due to a lower back issue. We can have nerve pressure, we can have imbalance and rotation going on that could be affecting that whole entire function. So If you would like to give my office a call, I'll put some information down below in the video. But we're located, again, Freedom Chiropractic and Holistic Health. We're located in Peoria, Illinois. You can go on our website, freedompeoria.org, or give us a call, 309-689-6200. Make sure you stop in again next week. We go live at 5 every Wednesday. Next week, we are going to be doing a demonstration on adjusting, so you kind of know what an adjustment looks like in our office. I have about 10 different ways I adjust. I don't do rotational adjusting very often, very rarely in my office, so we can keep you safe. And then also the ability to provide care through every age and stage, because we are a family chiropractic care office that takes care of kiddos as well as adults, and also adults that are enjoying their last years of life. Have a great rest of your day, and we'll see you next week.